Hi, my name is Becky Rizendahl, and I'm an associate professor of community behavioral health in the Colorado School of Public Health. Most people assume that a cancer survivor is someone who's survived cancer at least 5 years. That might be because many times when healthcare providers are speaking to patients about their prognosis or their survival, that they speak in terms of the 5-year point. But in fact, if you really look at what researchers and even cancer survivors themselves think about cancer survivorship, it really begins at the point of diagnosis, and it also includes family members and caregivers. And I think the reason that this is really important for public health is because recognizing that this period of cancer survivorship actually begins at the time of diagnosis, it can provide us an early opportunity to intervene and hopefully improve some of the longer-term outcomes that are faced by this population. Since President Nixon declared the war on cancer in the mid-1970s or so, we began tracking cancer outcomes, and interestingly, the number of survivors has dramatically increased from about 3 million from the time when it was first started to be measured until there's an estimated 12 to 13 million today. We're anticipating that by the end of this decade, there will be 18 million cancer survivors, and that represents about a 30% increase between now and the end of this decade. This represents about 6% of the U.S. population, but if you consider that cancer is primarily a disease of adults, it represents about 8% of people who are age 18 or older, and it represents about 15% of people who are 45 or older. Part of the reason this is also important is that 65% of cancers occur in people who are age 65 or older. So when we think about the aging of America, this is going to place a tremendous strain on the healthcare system. And so I hope I really convinced you that cancer survivorship isn't just an issue for the oncology community, but it's also very important for public health. In terms of the challenges faced by cancer survivors, both the type of cancer and the type of treatment can influence late and long-term side effects that might be experienced. So, for example, breast and prostate cancer are among the most common cancers, and what's interesting about them is that in many cases they're driven by hormones, and so the treatments are related to minimizing or attempting to minimizing those hormone levels. And so what can happen is that many of the late effects experienced by these cancer survivors are related to this minimizing of hormones. So it can be things such as fertility or osteoporosis. Many cancers and most cancers are treated with chemotherapy. These also come with some potential late and long-term side effects. A long-term side effect is something that starts when cancer treatment is initiated and then persists even after the treatment is complete. So a long-term side effect could be something like peripheral neuropathy, where someone experiences pain and numbness in their hands and feet. There's many disease-specific challenges faced by cancer survivors that may require intervention by an oncologist. These can be things like infertility, osteoporosis, and some physical effects. But I think what's important from a public health perspective is that, in fact, many of the challenges faced by survivors can be recognized in a primary care or other community-based setting. So, for example, about a third of all cancer survivors report significant distress, pain, or issues with their physical function that it can impair their well-being, their productivity and employment, and their overall quality of life. Survivors can face many challenges that can impact their quality of life, well-being, and productivity in the long term if they're not recognized and treated early. And studies have shown that when we measure these potential side effects in cancer survivors, that we do see more fatigue, more distress, and more pain among people who've had a past cancer diagnosis in comparison to those who have not. So when we consider that many of the risk factors for cancer, like lack of physical activity or being overweight, are also common risk factors for other chronic diseases like diabetes and heart disease, it's really not surprising that studies have shown that cancer survivors experience comorbidities about 1.5 times more frequently than people who have not had cancer. So for example, we know that changing behavior is really hard for anyone, and that's no different for cancer survivors. Studies have shown that only about a third of cancer survivors report that they've tried to change their behaviors related to smoking or overweight following a cancer diagnosis. And physical activity may even be reduced after cancer diagnosis and treatment. And this is especially important for us in public health because physical activity is one of the few interventions that we have good evidence to show can actually improve cancer survivorship, whether it be quality of life or ultimately increased survival. There's also good evidence about the role of smoking cessation and managing weight in cancer survivorship. And so what's especially important is that we recognize these risk factors and we intervene early with cancer survivors. So there's many opportunities for public health planners to have an important role in the cancer control planning process in their regions and in their states. So for example, many excellent providers are already out there, whether they be community-based or based in healthcare, that are already delivering quality programs for cancer survivors. So sometimes simply helping to serve as a channel where existing programs and services can network, can identify what programs and services are being offered and where is a really important role that public health planners can play. That is, again, creating a network and a method for communication, also a dissemination route for education about cancer survivorship, whether it be through the healthcare system or to cancer survivors directly, is another key route for public health planners. With the growing trend toward the utilization of evidence-based programs, it's going to be especially important as survivorship programs are being developed and implemented, that we also have very strong evaluation programs so that we can prove the worth and the benefits of these programs. And there are some very good tools available. The American Cancer Society, through their Resource Center on Cancer Survivorship, has published some good tools that give some guidance on how to develop a logic model and how to identify outcomes, and importantly, how to validly measure those outcomes for cancer survivorship programming. The George Washington Cancer Institute also has some terrific programs available on the internet, again, that can serve as guidance and a template for you when you're considering how to design an evaluation program and how to measure its effectiveness. So although it might seem overwhelming when we consider the complexity of needs in the cancer survivor population and the myriad of issues that they're facing, the great thing is that there's terrific reports that have already been published on this issue that can be of great use to public health planners in trying to consider what the needs are of the population and how to address them. They're wonderful resources, no matter how far along an institution or a program is in their cancer survivorship planning. What's also important to know is that the CDC has an ongoing monitoring system through the Behavioral Risk Factor Surveillance Program that does periodic enumeration of cancer survivors by type, by time since survival, and also can help in terms of the public health planning process. And so when we're thinking about where and how to identify evidence-based programs for survivors, in addition to these landmark reports that document the needs, there's also terrific resources for identifying specific programs for cancer survivors. For example, NCI's Cancer Control Planet is a web-based program that allows you to specify the population and the setting and the need that you're trying to address. And you can readily identify programs that you can pick up off the shelf and have very good guidance on where and how they can be adopted and how they can be implemented. Most of these are for psychosocial interventions or for physical activity interventions. There's other really good guidance from the American Cancer Society, where they've published multiple iterations of systematic reviews of the literature on nutrition, physical activity, and other habits for healthy living that are specific for cancer survivors that can serve as a great template for where to start with program planning. Other agencies such as the American College of Sports Medicine, the National Coalition for Cancer Survivorship, they all have resources for programs, and Susan G. Komen and the American Cancer Society also have local chapters that can be great resources for cancer survivorship planning and development. Many of the organizations that have produced informative and landmark reports on cancer survivorship are also key in terms of providing resources to cancer survivors throughout the United States. So this can include the Livestrong Foundation. They have great resources in terms of patient navigation that can address some of the financial and practical needs faced by cancer survivors. They also have available many web-based resources for cancer survivor education and caregiver education. The American Cancer Society has terrific resources for survivors where a survivor can go in and even specify their diagnosis, time since diagnosis, treatment, and receive very specific information about their ongoing healthcare needs. The American Cancer Society also has local chapters that may have access to peer-to-peer support and other support recovery systems. Similarly, the Susan G. Komen Foundation local chapters can also provide support for cancer survivors. Many cancer centers, whether they be academic community or community-based cancer centers, have programs for survivors where there can be support programs or ongoing community education. With the advent of healthcare reform, the future of cancer survivorship, I think, is going to be very bright, because good cancer survivorship care is really just good quality care. It's patient-centered care. It's care that's delivered in accordance with best practices, and it's care that's monitored in an ongoing way so that we can continually improve the outcomes for cancer survivors.